Hello, this is Dodie from Deliberate Aging. Welcome to my podcast. When I told my friends and family I was having hip replacement surgery, I was shocked at how many of them had already had this surgery. It seems that as we age, particularly as we get over the age of 50 and we lead active lives, we need to have surgery such as this, and it's becoming very common. However, as I talked to them about their personal experiences, I realized that mine was completely different from theirs. So let me tell you my story. It all started in November of 2023 when I started to feel a little pain in my left hip. It was very minor. You know, when you go to the doctor and they ask you to rate your pain on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you can imagine, at this point I was at a level 2 and it wasn't constant. It was only when I did very specific movements, like if you do yoga and you're familiar with child's pose where you're bringing your belly close to your thighs, that's when I would feel the pain in those extreme flexion positions. So my pain remained at that low level for many months. And the only thing that changed was that it started to appear more often. So I recently took up a new style of dancing, American Rhythm, where you're doing a lot more movement in your hips. And the rotation of the hips seemed to be causing me problems as well, so I'd feel the pain there. And still, pain was not constant. It was intermittent, so I didn't really think there was anything wrong. However, about 8 months later, I still remember the exact day when everything changed. It was July 27th of 2024, as I said, about 8 months after I originally started having pain. I was in Las Vegas at a dance competition, and I did a lot of dancing. And so I went to sleep after the competition on a Friday night, and I felt great. But the next morning when I woke up, again, it was July 27th of 2024, I woke up in excruciating pain. So much so that I had to take an over-the-counter pain reliever just to be able to move. So, if you're like me, if you have an injury and a pain, you just don't know what to do about it, right? Do you go to the doctor? Do you self-treat? And so at this point, I was self-treating. I thought I probably just pulled a muscle or something from all the dancing I had done previously. And so I decided I'm just going to take a break, no exercise for 1 week. And luckily, this coincided with a trip up to my hometown of Boonville, New York to visit my mom. And so I took that week to just rest my hip. After 1 week of rest, I returned back to my hometown in New Jersey, but I was still in pain. So I decided to see a chiropractor as a first step. Now, the reason I did that was because many years ago I had had an injury to my hip when I fell off a horse, and the chiropractor was able to help me to fix the problem. I went to the chiropractor consistently for 3 weeks, 2 sessions per week, but my symptoms did not improve. But at one visit, the chiropractor was kind of reviewing the sequence of events, what led to my pain, and he suggested that I might have torn the labrum in my hip. So I went home and Googled hip labrum tears, and sure enough, I had every one of the symptoms listed, including the clicking noise that my hip made when I walked. So I immediately called a local orthopedic surgeon, and this was about 1 month after the intense pain had started. I was really fortunate because I called a very popular, well-known surgeon at 9 in the morning. He had a last-minute cancellation. So 2.5 hours later, I was in his room telling him my symptoms. He did a brief exam, and he looked at both my left side, which was the injured side, as well as my right side, and he noticed a huge difference in my mobility. And of course, he asked about my pain levels. So he sent me over to the x-ray department in his office. And when that came back, he was quite surprised that there wasn't really anything remarkable on the x-ray. So he said, there's got to be something else going on. And of course, he ordered me an MRI. When I finally got the appointment for the MRI, I was a little shocked. Now, this is only the second MRI I've ever had in my life, so I don't have a lot of experience with these. But I did learn something very interesting that I'm going to share with you. So if you go into the MRI office for a hip procedure, they're going to make you lie flat on this table and they don't want you to move your legs or your hips. So they put a strap around your ankles so that you can't move. And you're instructed to lay completely still for the whole length of the procedure, which takes about 20 minutes. Now, with my level of pain at that point, that was the worst position for me to be in. And I was really tearing up by the end of the 20 minutes because it was very painful. So what I'd like to share with you is, in hindsight, if I had known that this was going to happen, I would have taken an over-the-counter pain med before, just to diminish the pain symptoms that I was feeling during the procedure. So after the MRI, of course, you have to wait for the results. And in my case, there was a holiday weekend, Memorial Day, over that time period. So the results were taking a little bit longer than normal to come back. So I was still in this intense pain, so much so that I actually couldn't even sleep. I could not find a position comfortable enough to sleep. And so I again went to Google, decided I need to somehow decrease the inflammation in my hip joint, and maybe that'll have a beneficial effect on my pain level. So I did my research and I found out about the things that I shouldn't be eating. But in addition, one of the things that kept popping up was turmeric. So I grabbed a bottle of turmeric, nothing special, just I got it from Amazon, and I took it according to the directions, 3 capsules per day. And I kid you not, after 1 week of taking those, as well as following the anti-inflammatory diet, no alcohol, no sugar, no processed foods, I had a dramatic improvement in my pain, so much so that I actually could sleep, which was such a nice thing to experience after not being able to sleep for probably a month. Then, of course, I got my MRI results back, and it showed that I had a couple of labrum tears and some arthritis. So I did my research, again, went back to Google. So before I went to the surgeon the next time, I kind of already knew what he was going to say. And basically, he did say, if you're in constant pain, which I was, the only option, or the best option, I should say, would be a total hip replacement. And so I knew that after my research, and I agreed and immediately went over to his surgical coordinator and we booked it. And the date I was given was actually 2.5 months away from that current date. So I still had 2.5 months to go of pain before I could get this problem fixed. So I asked the doctor, what can I do to improve my chances of having a better surgical outcome during these 2.5 months while I'm waiting? Can I continue exercising? Can I continue dancing? Or would I make it worse? And he said, absolutely not. There's nothing you can do to make it worse. So keep exercising, keep dancing. Get yourself as strong and as healthy as possible before the surgery, and you'll have a better outcome. So, of course, during those 2.5 months, I'm taking care of myself, but I also get a package from the surgical center with all the things you need to do in advance. You have to go get your general practitioner has to clear you for surgery. You need to have an EKG. You need to have blood work. And so I did all of those things. And you also have to stop taking specific medications as you get closer to surgery. And it talked about anti-inflammatories. So I assumed turmeric probably fell into that category. And I actually did call the surgical coordinator to confirm, and she said, yes, stop taking the turmeric. I think it was about 1 week prior to surgery. And so I did that reluctantly because I was afraid that I was going to get more pain from not including that anymore. So the day of surgery finally arrives. I have to get up very early because I have to arrive at 6:15 a.m. for a 7:30 a.m. surgery. I arrived at the center, filled out some paperwork, and was ushered into a private room, changed into my gown, socks, and a thing to put over my head to cover my hair. They give you pills for pain and inflammation. So I was able to take those with a small amount of water because prior to this, you can't drink any water on the day of surgery. And so they put my IV into my right hand because they were operating on the left hip. The nurse took my blood pressure, my pulse, my temperature, and she also had me swab my nose with this thing that looked like a giant Q-tip covered in an orange antiseptic cleanser. She said she wanted me to be as clean as possible. So she checked the surgical spot to see if she needed to shave it. All of that's done. And then I start having all these visits from different people. So the OR nurse came in and she was lovely. She explained absolutely everything that was going to happen. And then the physician's assistant came in and answered all of my questions. The anesthesiologist just followed, and then finally my surgeon came by as well. And then basically, by my originally scheduled time, 7:30, I was in the OR getting my anesthesia, which is basically a small prick along your spine. And then you lay down, you fall asleep, and half an hour later you wake up in the recovery room and it's all over. After the surgery, I wake up in the recovery room. A nurse is taking my vitals and gave me something to drink. And then as soon as I finished my coffee, my husband came in, helped me get dressed, and the physical therapist actually had me get out of bed using a walker, and I walked up and down the hall, as well as I walked up and down this small set of stairs. So they immediately want you to get up and get moving. And also the thing that kind of shocked me was that to get to my car, I walked. Normally, other surgeries I've had, they put you in a wheelchair and wheel you out. But this one, nope, they have you walk right to your car. And there was no pain actually at this point. It was just I felt a little wobbly and unstable. So my surgery started at 7:30 a.m. Less than 2.5 hours later, I was in the car heading home. And I'm going to call my surgery day number 1. And there really was no pain. It was very simple. It was very easy. When I got home, I was a little tired, and so I laid down. But again, there was no pain. And I did strictly follow the doctor's orders, which was to have ice 20 minutes on, 20 minutes off, and to elevate my foot as much as possible. And day number 2, which for me was actually Thanksgiving Day, the physical therapist came to my house and had me start doing exercises. In bed, but also he got me out of bed and had me start walking using my walker. And he did say that every single hour throughout the day, I needed to get out of bed and do some walking. My physical therapist also taught me the big 2 hip precaution rules. The first one is 90-degree rule, meaning you cannot bring your knee closer to your torso. Meaning, so if you think about your thigh bone versus your spine, you cannot break a 90-degree angle on the surgical side. And that's going to apply until I go to my post-op appointment with the surgeon. The other rule that will apply for the same length of time is not to cross your legs or your ankles. Because both of these 2 things, if you did them accidentally, could cause your newly implanted hip to dislocate. So I continued to improve, doing my exercises, walking with my walker. The physical therapist came every second day to my house and gave me progressively more intense exercises just to bump up my strength. And the pain level was really very low. I took pain meds at night to help me sleep. But other than that, I only took extra strength Tylenol during the day. So the one thing that was causing sleep issues is because you have to wear a brace on your leg and you have to lay on your back. So it's relatively uncomfortable to remain motionless on your back, particularly for me who I tend to flip around and sleep on my side most of the time. So that's why I took those pain meds for a couple days. But after 3 days, I was done with those, just using the extra strength Tylenol, and there was no pain at all. So the physical therapist has you progress from walking with your walker till eventually you walk with a cane. And finally, I was walking outside on day 10 for 8 whole minutes using my cane. That was a big accomplishment for me because it was the first time I had left the house since my surgery. On day 15, I had my post-op appointment with the surgeon, and they take off the bandage as well as they take out the sutures and they do an x-ray. And luckily for me, my x-ray came back very good, and so I was cleared to drive. Now, my surgery was on the left side, so I only needed to stay away from driving for 2 weeks. I believe that would be different if you had your hip operated on the right side. So this now means I can drive myself, and physical therapy will now be outside of my home as opposed to them coming into my house. This is also the time when I started walking up and down stairs as normal. And when I say as normal, I mean 1 foot on each step. Prior to this, the physical therapist has you practice going on the stairs, but you put both feet on the same step in order to go either up or down. So as of today, I'm now 3.5 months post-op, and I've resumed all my normal activities. There's still a little bit of swelling and tenderness when I overdo either exercise or maybe I sit in a chair for too long. But other than that, I am doing really, really well. And so what are my biggest takeaways? What did I learn here? Well, number one, I can't do this alone. I needed a lot of help at the beginning, getting in and out of bed, and even something as simple as putting my socks on. Remember I talked to you about the 90-degree rule, which is a big hip precaution. No. You can't break that 90 degrees. And so that's how you typically put your socks on, is to bring your knee close to your chest. So my husband was doing that for me for quite a while. And I also learned that I just need to be patient. I'm not used to sitting around. I'm typically a high energy person who's always on the go and moving. And I needed to accept the fact that my body needed that time to heal. And so I'm really glad that I did take that advantage of that. Give my body the time it needs and just let it do its thing, because the body really does have that instinctual ability to heal and take care of itself if you just listen to the signals it's giving to you. So basically I have not had a lot of surgeries in my life. I've had maybe 4 orthopedic surgeries, but this was the easiest for me. And I think why it was the easiest is because I really took it very seriously and prepared myself in advance by cleaning up my diet, eating well, exercising, making sure to strengthen the muscles that I knew were going to be affected directly by the surgery, like the legs and the hips. So I put myself in the best position possible before it even happened. And then post-surgery, I followed all of the doctor's instructions. The ice, the elevation, the physical therapy, the walking, everything that they recommended that I do, I did. And so I'm really happy with the outcome. My hip feels great now. Like, as I said, there's a little bit of tenderness, a little bit of swelling still, which I'm giving my body the chance to get rid of that. But overall, I feel like that was a really good decision. I know some people would maybe opt to make the alternative decision, and that's something that's personal to each individual. But for me, I think that I made the right one. So I'm very happy. I hope some of the tips provided in here will help anyone who is about to undergo this type of a surgery. But also, I would really love to hear from anyone else who's undergone this type of surgery. What worked for you? What didn't? What recommendations would you give to other people about to undergo this type of surgery? I look forward to hearing from you. Thanks for listening. This is Dodie from Deliberate Aging. Until next time, be well, friends. This podcast is presented solely for informational and educational purposes only. Use of information from this podcast is at the user's own risk. It is not intended as a substitute for the advice of your physician or other qualified professional. We are not responsible for any losses, damages, or liabilities that may arise from use of this podcast.